Hi, this is Dr. Matt Lasorsa. And if you're doing a lot of implant dentistry and you're tired, if you're tired of implant failure, if you're tired of when you do full arch cases that you're getting screw loosening, MUA breakage, screw stripping, chipping of zirconia, fracture of zirconia, the patient's complaining about clacking. If you want to find a solution to do less bone reduction, then I want to welcome you to OsseoPure. We're a new and innovative dental implant company. OsseoPure was started by a number of founders, including clinicians and lab techs, to address all these problems and create a system to avoid all these problems. This company was founded to make it more efficient, less components, easier for the beginner, ready for the expert. I want to show you all the options that OsseoPure has. Not only are we making 5 different lines of dental implants, components, we also have a fully functional lab and a new state-of-the-art training facility for our doctors. We're going to accommodate your style of implant dentistry, so we have multiple options. The smallest implants we're making are mini implants, your traditional ball and square mini dental implants to use for removable appliances like dentures. For calling them the Mobis, that's an acronym for mini O-ball implant. Right now, we're making them in 2.5 millimeters. There's a fine pitch thread for the mandible, a wide pitch thread for the maxilla. But coming soon, we're gonna have a 3.0 for the maxilla and a 3.5 one-piece O-ball for a removable denture. The next implant is gonna be the flagship of the company. These are the Pilaster implants. The Pilaster implant is a one-piece dental implant that has a built-in MUA and screw channel. Now with the Pilaster implant, you can use it for a single tooth. It would be an abutment level implant. You can use it for small bridges, and you can use it for full arch, whether it be removable or fixed. Okay, if you look behind me, there's some diagrams of a Pilaster implant, abutment level, so tissue level implant for a single tooth crown. Now I'll say with the single tooth, you will need a tie base because it needs to be indexed, okay? But it's a tissue level implant. Usually we have problems with the abutment, but when it's built in, there's no micro movement. If you want to use them for a removable appliance, you would place 2, 4, 6 implants if you want. This is called an equator abutment that would go onto the Pilaster. The equator abutment is similar to a locator that would screw onto your Pilaster implant, and you could have a snap-on denture. For fixed arch, which is really what they were designed for, you can have your fixed restoration screwed directly to the implant platform. No need for tie base, no need for screw channels, no need for angled MUA, so that you don't have to do a whole lot of bone reduction, okay? We have a built-in MUA, you don't have to accommodate for it, not a whole lot of bone reduction. We're starting out small with the Pilaster. You can get a 2.5 diameter Pilaster. It's basically a mini. Okay, but it's got a screw channel. It's made for a fixed restoration. We also have a 3.0, a 3.5, and a 4.0 Pilaster implant. A lot of specialists, oral surgeons, periodontists, they don't like the idea of placing a one-piece implant. They're used to placing a 2-piece implant like this, which we have those also. I'll talk about that in a minute. So those of you who are not accustomed to doing this full arch surgery, this will be seamless to be able to place these one-piece implants and be able to restore a full arch. Another part of the versatility of it is, let's say you plan for a full arch. Maybe you didn't have as much bone as you thought in the posterior, you could only get a few in the anterior. It's not the end of the world, okay? It's not a one-dimensional implant. You could put the equator abutment on it and make it a removable appliance. If the patient starts with a removable appliance because that's all they could afford or that's all they wanted, you can start with that, and 6 months, a year, 2 years later, now they want something fixed or now they can afford it. You simply take the equator abutments off, maybe you add 1 or 2 implants here, and now you can do a screw-retained fixed restoration, okay, without changing your implants, without getting crazy. Whenever I show these implants, especially with this image, the first thing everybody says to me is, yeah, but all those implants are parallel. How do you restore that if the implants aren't parallel? You can't always do that. Well, yes, we can. These implants, there's no limit to how divergent they can be. This model is a blown up model of the connection. Now these implants are placed 90 degrees divergent. I mean, nobody wants to place an implant that's 90 degrees divergent, okay? But the point is, we can still seat the bridge passively no matter what the divergence is on those implants. Now, you will have to be conscious of where your screw axis is going to be. If you want to angle an implant, the screw axis is going to be on an angle. That's not a big deal. Where it becomes a little more complicated is on the maxilla. Okay, you want to make sure, if you're doing implants on the maxilla, that the screw channel isn't going to be to the buccal. Okay, but we've got a solution for that too. If you think your screw axis is going to be to the facial, you simply switch to the two-piece implant, and we have angled MUAs to get that access to the lingual so it won't be seen. Our two-piece implant, we're going to have two different lines of them. This one is called the Intrahex, or sometimes listed as the hexagon implant. This is Megagen compatible. So if you're a Megagen user, you can still use your surgical kit and your prosthetic kit. The benefit of having both a one-piece and a two-piece implant is if you have a long, thin bone towards the interior, and you can put a small diameter implant, like a Pilaster, from 1.5 to 3.5. As you step back a little bit, maybe you can use the 4.0 Pilaster, but then as you get to the posterior, you start getting short bone above the IA. You start getting short bone above the sinus. Well, you can switch to our two-piece implant. Okay, you can angle it, and you can put in an MUA, or if you get torque, you can just use a short implant. Once you put the MUA on there, it becomes the same connection as the Pilaster. The MUAs, we're calling them Pilaster abutments. Really what that means is it's an MUA that has the same connection as this Pilaster. Whether you place the one-piece or the two-piece or a combination of them, prosthetically they all become the same. We're going to have a 17-degree angle, a 30-degree angle on the MUAs for the two-piece implants so that we can accommodate any angle you need to place, whatever shape the bone is in that you need to restore. There's going to be another line of two-piece implants that's going to be called the hexalobe implant. The hexalobe implant is going to be Straumann compatible. You'll be able to use the same surgical kit, the same prosthetic kit, the same components if you're a Straumann user. Now, these aren't clones. I don't want you to think we copied Megagen or we copied Straumann. We have our own patented surface design, our own threads, just the connections are going to be compatible. The screws we're using to tack these down, this is called the spherical screw. The spherical screw in itself has changed the prosthetics. The biggest weak point in these fixed implant restorations was that 1.4 millimeter screw that most of your implant companies will give you. And that's where we get screw loosening, strippage, breakage. Once you get screw loosening, you lose that cross-arch stabilization, and that's where you start running into problems. This spherical screw is self-centering, and it is a 1.6 diameter screw. Just that little extra bit of material makes it a lot stronger. That has solved so many problems down the line. Now, we are manufacturing 1.4 spherical screws to do any kind of a rescue case. If you have a case that you've done years ago, you have a case that came in from another office, the prosthetics are failing, but the implants are okay, we can restore that case using the spherical screw with a new restoration, and you shouldn't have any problems with screw loosening again. We have a very advanced surface and very aggressive threads. These threads are made to be inserted and create immediate stability. You may not get that crazy torque you get with some other systems because they're using a compressive thread. There's a limit on how much torque you want on insertion. Too much torque, you can cause bone compression and necrosis because you're squeezing those blood vessels. These were designed for aggressive threads, immediate stability, immediate load. The surface on these implants is a nano-textured surface. So what that means is no matter how much you magnify it against the implant surface, it's a roughened surface. So the body thinks that that surface is bone and adheres directly to it. As you magnify the surface behind me, the more you magnify it, it still remained a roughened surface. You never see a smooth surface. So it actually stimulates bone growth. It is surface treated with a calcium phosphate treatment, but it's not really the calcium phosphate that stimulates the bone growth. It's the nano-textured surface of the implant. In addition, we're gonna have a crown and bridge abutment one-piece implant. Okay, similar to the Pilaster, which has a built-in MUA, this is going to have a built-in crown and bridge abutment. But the difference between our one-piece crown and bridge abutment implant and some of the others on the market is look at the top of the abutment. It's got a screw channel in it. Okay, so what that means is you can cover over this and you can have a traditional cement retained crown over this one-piece implant, but you could also have a screw retained crown on this one-piece implant. Now, these are good for people that are healthy, have healthy teeth everywhere else, but maybe they're missing one congenitally, or maybe they had some kind of trauma, some kind of accident. So they're missing one tooth, everything else is healthy. Now you do need some vertical clearance for these because you can't alter the abutment. So there's not a big demand for these, but it is a nice, efficient, and economical way to restore one tooth with a one-piece implant. When we do a full arch restoration, we're going to use a Zantex substructure for strength. Zantex is very light, it's stronger than titanium, and it bonds to all our restorative materials. We can overlay the Zantex with zirconia, we can do it with lithium disilicate, we can do it with acrylic, but our favorite is Amberino. Amberino is nanoceramic with 90% glass, 10% composite. It's also very light, very aesthetic. It bonds to the Zantex. The benefit is, if you have a full arch zirconia restoration and the patient chips or cracks it, you have to mill it out all over again. With Amberino, you can bond composite to it, so you can fix that intraorally. Another advantage, if you use Zantex and Amberino for a removable appliance, it's relineable in the intaglial surface, so if the patient loses weight or over time they need a reline on the removable appliance, you don't have to mill out a whole new bar. This Zantex, our lab is going to guarantee it for life. So if somebody were to break it, we'll just simply mill out another one for you. The Zantex restorations that we're doing, you can do FP1, you can do FP2, you can do FP3. Here's an example of an FP1. Here's the Zantex substructure, and this could be either acrylic or lithium disilicate or zirconia or our favorite Amberino to overlay it. There, and there's your FP1 restoration, okay? No pink, you keep the dental papilla, very aesthetic, very strong, don't have to do much bone reduction at all. Some of the things that may intimidate some dentists about doing a full arch implant case is, they think it's going to be too much for their patient or too much for them personally to do this full arch case. A lot of the GPs will refer to their periodontist or their oral surgeon to do some sedation. I personally don't do any sedation at all. The most I'll ever do is if a patient is really nervous, we may prescribe some oral sedation to start the night before and have a driver to bring them. But I don't do any kind of IV sedation, okay? And I do full arch cases all the time. Some of the other things that may intimidate them is some of these big corporate offices that do all on 4, all on X clinics, they do a lot of bone reduction. And a lot of dentists don't really like to do that much bone reduction just to get a restoration in. With the one-piece implant, the Pilaster implant and the built-in MUA, you don't have to accommodate for that much vertical because the MUA is already built in. Also with the Zantex restoration, that we're not using a tie base or we're not using zirconia, we don't need that much vertical on the restorative side either. We're screwing directly to the implant platform, so that collapses the vertical we need. So, usually you do have to do some type of reduction, especially on the maxilla, just depending where the lip line is, but it's a lot less than just trying to make space for restorative materials. Another thing that dentists worry about with full arch is, they're married to that case after. The combination of preserving the bone, using these aggressive thread implants for immediate load, using this bioactive surface to make sure the bone adheres to the implant. There's no internal parts to fail. You're not getting screw loosening. The problem with a full arch restoration, once you get screw loosening, you lose that cross arch stabilization, okay? Once you lose that cross arch stabilization, that's where you start getting MUA breakage, screw breakage, stripping problems, occlusal problems, then you start getting bone loss around your implants. If we're stabilizing the arch and we have these spherical screws, which really we don't have any problems with, they don't loosen, they don't break, they don't strip, we're not having these long-term restorative issues. Once you do an implant case, that is true, you are married to it, but you should have a lot less problems down the line if the case is planned correctly, if it's restored correctly, and the patient is healthy enough for implant treatment. We're going to have a full lab support. We're going to have training. We also own a number of dental clinics around the country. So our dentists are doing these cases, and our lab is seeing these cases clinically. So not only are we getting feedback from our other dentists, the lab is seeing thousands of cases every year, so we can pick up on any discrepancy or any problems that need to be fixed. That's how OsseoPure got started. It was between a couple dentists and a lab, And they realized that the implants could be changed, the components could be changed, but there was nothing like that on the market. So they developed all these systems to streamline these problems. So it's taken all the stress out of doing full arch restorations. The surgery, once you're trained, is fairly straightforward. You pick and choose your cases. You know what you're capable of. You know what cases maybe you shouldn't do until you're a little more advanced. But that's why we're working with beginners, we're working with intermediates, we're working with experts. Everybody can take advantage of this system. I would like to personally invite you to one of our courses. We would like to spend some one-on-one time with you to go through all the solutions we've come up with to deal with these problems. This is information that you can take back to your office on Monday morning and immediately incorporate the surgical protocols, the digital workflow, and the prosthetic protocols to make sure your work is efficient and long-lasting. So if you're interested in attending one of our courses, just fill out the form, click the link below, and we hope to see you soon.